All right, find a seat, everybody. You can talk about cable. Hi, everyone. Welcome to our management Q&A today. For those that don't know me, I'm Michelle Gramolia, the CEO of Woodland Pond. We're going to go through our directors that are here. I'm going to start with Shannon in one moment, but before I do that, I just wanted to give you all a quick update. I did have a chance to go visit Sarah yesterday. A number of us had been visiting with her last week, and then several went to the wake. I did not, as you know, but I did go to the funeral on Saturday, which was absolutely beautiful. I don't know how many of you had the opportunity to watch the service for her family, but it was lovely. And yesterday, the 14th of July, was Sonia's 10th birthday. So a number of folks, and then also Woodland Pond, had provided gifts for her. So I brought those over to Sonia yesterday. And Sarah did ask me to stay for a bit, and we had a really nice visit. I think the most important thing for all of you to know is that Sarah is very stoic, but she is having moments of sadness, which is, I think, a great sign. She's not being stoic all the time. She's, allowing herself to, have the sorrow and mourn Joseph's passing, and her ex-husband. She is so appreciative of everything that the residents have done to support her. She's making her way through all of your cards. She is saying, she needs to take a few at a time because she's quite overwhelmed with your love and support. But Sarah has an amazing support system. She's very faithful in her church, and her church has really rallied around her, as has the regional community at large. So she says hi to everyone, and she sends her love, and that's how she's doing. So Shannon, would you like to speak to us next?
Hi, everyone. I'm Shannon Scatoro, the Director of Marketing. I just wanted to remind all of you that we are offering tours again for independent living prospective residents. I know many of you have probably seen me and Courtney walking around with some new people. We do also have some new folks that are moving in and some that have already done so. And we have a few available apartments. So if you have any friends that have been thinking about it, or are thinking about it, just have them give us a call and we can walk them through everything. All right, that's all I have. Thank you.
I'll be the disinfecting person. Hi, everybody. I'm Bridget Blum, Director of Human Resources, and I just wanted to, again, on behalf of the employees, thank all of your generosity in the donations that you have given for the COVID assistance for the employees. We have had to date over 52 applications and grants that have been given from those funds, and those grants total more than $26,000 that we've given to date. So that's fantastic. I am still steadily receiving requests from employees. So if you haven't yet made a contribution and are interested, certainly that would be welcomed. But again, for those of you who have, we really want to just say thank you. And the employees couldn't be thrilled. I had someone in tears in my office today, just so thankful for the gift that they were able to be given. So thanks again. Next up, we will have Ronnie. But Ronnie, I wanted to say thank you. Come on in. Okay. I've heard some reports that we gave out some ice cream.
We did.
What did we give?
We had some, what did we have today? We had, yeah, ice cream. We had ice cream sandwiches. We had strawberry shortcake, eclairs, king cones. We gave out a couple hundred of them, so I'm glad to have seen everybody. Okay, so Michelle introduced me, Ronnie Licata, Dining Director. I just want to talk to you guys about the menu. The longer we continue to do to-goes, I'm realizing that we're going to take a deeper look into what we're serving. we kind of put that menu together really fast. We've made some tweaks to it over the time, but Mike and myself and Chef Josh are going to sit down tomorrow and really look at the offerings, not only from a variety, from a quality, but how it translates when it gets to your apartments and how you guys cook it. So we're going to be taking a really deep dive into that tomorrow. The second part of that is I want to make sure that you guys understand that I want your opinions. So there's a couple different ways you can contact me. The suggestion box outside the hostess desk, I am still monitoring that. If there's a specific item, I'll throw out like crab cakes that you're really looking for, please let me know. The best way is by email. We don't need 300 people walking the hallways to drop off their food suggestions, but you can email me at rlicata@wpatnp.org. You can drop them off at the hostess desk. When the hostess calls you for your order, if there's something that you're really missing, you can just let them know and they can write it down for you as well. The second thing is that we are still actively working with the Sustainability Committee. I believe we have a meeting tomorrow, right, Rob? It's a long process. There's a lot of different pieces to it, but the containers are a huge part of what we're talking about in sustainability. And I just want to make sure you guys are all aware that, we're using the containers we are right now because they are the best for the service that we're providing. And when we do make a change, it will be for the long term and what will be best for this community and the services that we offer. Again, please share your comments. I've had, lots of suggestions. I need them. I don't see you guys anymore, so I really need to know what you want from us and what's not going well. Okay, thank you.
Before I hand it over to Rob, just to Ronnie's point, we are really going to be working hard to try to get back to committee meetings, even via Zoom. I had a discussion with Tom this morning about which rooms within the community are on their individual HVAC units, because in those cases, we may be able to start limited group meetings with 10 people or less. So committee meetings are something we're very interested in getting back to, because we absolutely are missing that feedback and the interaction that we usually have with the residents. And I know it's an opportunity for us to improve quality and your experience as we go through this. Mr. Dunn?
Thank you. Good afternoon, everyone. I'm Robert Dunn, Director of Environmental Services. Two things for me today. Michelle had sent out last week, I think, a survey on the cable services, a questionnaire. We need that back by Friday, please. And reach out to me if you have any questions on the cable service or any of those questions that are on the survey. It's rather important that we get that back by Friday, right? The 17th? Yeah, the 17th is when we need that by. The second thing also, we will be resuming housekeeping and independent living on Monday. We canceled this week and the previous week. So for all of you that were canceled last week, we will pick up with you starting on Monday. All right, so it would be 2 weeks from that first canceled week. And then those of you that were canceled this week will be 2 weeks from this week. All right, will be the following week. So it keeps us on schedule and it doesn't throw the whole schedule off. So if you have any questions on your housekeeping or your housekeeping schedule when it'll resume, just give me or Carrie a call and we can, give you the day and the time. The times are all the same, so we'll be back on track. Okay, thank you very much.
Thanks, Rob. Okay, so I'm just gonna be Tom Tango for a second because he's not here. Oh, my impression needs some work. So he just asked me to talk to you about a couple of things. So for those that don't know Tom Tango, he's our Director of Resident Services. A few things for him. We are beginning next week a new staff position here at Woodland Pond to provide resident support in the form of a resident technology assistant. And this is not to, play Apple or Microsoft. So this person is there to help you with your, maybe connecting your printer, downloading Facebook, connecting you to Wi-Fi, helping you figure out how to use your smartphone, getting you onto connected living is a big one. All of the new technologies that were becoming so, prevalent in our lives, using Zoom, your child sent you a new tablet, helping you set that up. This is that technology support right here on campus. There is a very minor fee to do this, but it's no different than if you needed maintenance to come in and do something special for you. And it allows you to do it right here on campus with our help. Those are billed hourly in 15-minute increments though, and we're looking to keep the cost as low as possible. We're trying to get that technology into your hands. And so those appointments are being booked on Tuesdays and Wednesdays starting next week. The resident technology assistant is actually Cassidy, whom many of you remember from the dining room, who has now moved into working within Jason's department. So she's going to split her time between concierge, a little bit of reception, and she will be the resident technology assistant. She was one of several candidates and had the qualifications that we were looking for. We will expand those available days and times as needed as more requests come in. The next thing for Tom, or I guess Rob, is that hopefully you all saw the announcement that on Thursday the 23rd, which is a week from tomorrow, from 11 to 1 p.m., we will have a large confidential shredding truck out in front of the community building lobby. This is something that one of our board members subsidizes for the residents each year. He is a CPA and he knows how important paperwork can pile up. It's Mark Shane. His firm is right across North Putt. What you should do is spend your time, we don't have a lot going on right now. This would be a great year for you to spend the next week going through your papers and getting ready to chuck all the things that you really don't need. It is one of the most frustrating things that we see families dealing with when somebody has to, move to a higher level of care, and then the family, is here to help the transition. And they're finding, piles and piles of 7-year-old cable bills. You don't need to hang on to that stuff. So if you have questions about what you should or shouldn't keep, you can call down to concierge and they'll put you through to me and I'll give you some guidance on that. I mean, bills for the newspaper, it doesn't matter. Keep 6 months of that. Taxes, of course, keep for a longer period of time. But this is a great year to really lighten your load from a paperwork perspective, and it costs you nothing. So please try to take advantage of that on the 23rd, which is next Thursday from 11 to 1. Okay, so just switching into a couple of housekeeping type items that I have, or more minor items of interest. Kim and I met yesterday, and she's looking to make some changes to what she's doing. So you are going to start to see very soon a few more things from Kim. She is going to be scheduling an 8 a.m. walking group starting the Monday after next, and that will be sign-up based. We will get information out to you in the Chanticleer. It will be safely distanced, and that'll be great. 45-minute walks. Mondays through Thursdays, and she hopes to expand that later in the days when the weather permits into hikes on the trail system. She's excited about that. She's also going to start up her one-to-ones again. So we've identified a way that she can do so safely, and you'll see information asking that if you want to do a one-to-one with Kim, she is going to be scheduling those again, and she's really excited about this. This is really her bread and butter. She wants to get to know all of you on an individual level. She's feeling hungry to do so, and she wants to use those meetings with you to get to know what kinds of services she can be helpful in providing at Woodland Pond. So you're going to see her a lot more again, and she's super excited about that. One other thing I just want to clarify before I get into the reopening memo and those activities, a number of you have asked me questions about leaving campus. So campus is not locked. Campus has never been locked. The reminders about what you need to do if you go off campus have changed over time. They've come and they've gone. But currently, if you wish to leave campus, you're certainly welcome to. The circumstances under which you leave dictate what happens when you get back. So if you leave campus in your own vehicle and you go anywhere other than the hospital, just for a quick visit, you just need to monitor yourself when you get back. You need to keep safe distance when you're off campus, and you need to wear your mask all the time. But then when you get back, as long as you didn't go to a hospital, you just need to monitor your own symptoms for 14 days. We've hung signs with the new CDC recommendations all over campus. The signs and symptoms of COVID have changed as per the CDC. You can find a copy of those symptoms. I think there's 6 or 8 of them now. But we just are telling everyone, monitor for any sign of illness and check your temperature twice a day. Anything over 99.6 or any symptom that concerns you of any illness should be reported to your physician and to Mary Jo or to the concierge. But your physician should be notified. That's if you leave campus to go to the grocery store or whatever the case may be, in your own vehicle. If you go with somebody in the car that is not a member of your household or your approved caregiver, then you would need to quarantine, even if you are masked, unless you're on a Woodland Pond transportation. So the quarantine rules, anytime we say you would need to quarantine, the current guidance is you need to quarantine fully for 14 days in your apartment or cottage, or you may be tested out of your quarantine if you receive a rapid or any other type of COVID test and the test is negative. The ticket is you have to have the test more than 4 days after your exposure. And I will include some of this in the Chanticleer because we've had it in there, but I know that people still have questions. You can certainly go away. Obviously, there's a travel advisory right now, but many of you have children that would like you to come stay with them for a few days. You can absolutely do so, but when you come back, you're going to be on the quarantine rule. So either fully quarantine for 14 days, or if you wish to test out, you may do so. The easiest thing for you to do if you wish to test out is call Mary Jo, and she'll give you those details. But we want you to be doing what you feel like you need to do to get yourself through this. It's just there are steps that have to happen when you come back to the community. All of these things are also written on the front door signs that have been hanging for some time. You can kind of see that there as well. So we'll just continue to reiterate this message to everyone. Okay, so those were the general things I wanted to go over. You guys really can go. You don't have to sit here. I wanted to go through, I issued a reopening memo today, number 3, and I appreciate your patience. It was my intention to get it out yesterday, but I had to work through some details on a couple of the things, so we were finalizing that this morning. So, you know, I went through, hopefully you've all seen this memo by now. I'm actually gonna read it, because for those that have not seen it or do need reading assistance, I'm going to read it and then I will address some of the issues. So this is an independent living resident memo only. A memo for the health center residents will be issued tomorrow. So this is the Woodland Pond reopening memo number 3, dated July 15th of 2020, and it's prepared by myself, Michelle Grimolia, the president and CEO of Woodland Pond. The best news of the day is that we have no new COVID cases. This memo applies to independent living only, and a separate memo will be issued for the health center. Dear all, I'd like to take some time to update you on a number of things that have taken place on campus over the last several weeks since we began reopening activities in independent living, then had to put them on pause. I'd like to explain what we've learned and how our approach to the reopening will change as a result. We will cover these in detail today at 3 p.m. Well, here we are. This, incidentally, this is being recorded for our YouTube channel and will be ready to air shortly after we're done here today. First category, what has taken place since mid-June? Independent Living Loved Ones pilot program, followed by a planned 2-week pause. Hair salon, bank, alfresco dining, resident-to-resident visits, and certain activities started. Then an independent living staff member tested positive for COVID, which we discovered, the report came into us on July 4th, which resulted in the following. The loved one visit pilot pause was extended indefinitely. All activities that had resumed were paused indefinitely. Contact tracing activities were performed, and those residents with confirmed exposure were split into 3 risk categories, defined as follows. High risk, which is defined as prolonged or more than 15 minutes exposure to the staff member that had tested positive with or without masks, or prolonged unmasked exposure to someone who had exposure to the staff member. Medium risk, which was prolonged exposure masked to someone that had exposure to the member. And low risk, which is brief exposure or less than 15 minutes masked to someone that had exposure to the staff member. So we had the high risk, the medium risk, and the low risk. Notifications were sent to each of the exposed individuals based on the above tracing, and the post-exposure requirements were explained. The post-exposure requirements ranged from a full 14-day quarantine with the option to test out of quarantine after a defined period of time, being the highest requirement, to a 14-day period of self-monitoring for symptoms of illness, and that was applied to the lowest risk folks. So as part of this one incident of this staff member testing positive here in independent living, post-reopening, which is why we had to do the contact tracing, 85 incidents of exposure were traced. Of the 85, 45 of those individuals fell into the highest risk category. So either had direct contact with the staff member, meaning they were in the same room or something like that. It didn't mean physical contact. It meant 15 minutes exposure, with or without masks to that staff member. So there were 45 out of the 85 were in the highest risk. 17 of the 85 were in the medium risk, and 23 were in the lowest risk. So you can see how quickly, we have about 250 independent living residents, maybe another 30 staff members in independent living. And then this also got traced back to companions, or if somebody needed to go to the doctor's office or whatever during that time. Anyone that we could trace, we traced. The other thing that resulted from the staff member testing positive and our efforts to reopen is that we did make a decision to mandate that all Woodland Pond staff be tested for COVID once per week. The prior requirement under the executive order of the governor was only the health center residents. We had also included crossover staff, but we are now testing all staff on a mandatory basis once per week. And so that also resulted from this. We do have the ability to test staff here on site. So it's quite convenient and there's no cost to the staff. So that will help us absolutely move forward in our reopening plans. So what have we learned? We've learned that of the 85 traced exposures, 44 were specifically related to reopening activities, okay, across the high, medium, and low risk categories. So what does that mean? That means that of the 85, if we had not already engaged in reopening activities, like the bank, the salon, alfresco dining, and resident-to-resident visits, 44 of those contacts would not have happened. So I just want to stop there and just let that sink in for a second. So these are the numbers that we're dealing with as we go forward. So 41 would have happened regardless, because it was just in the normal course of operations here at Woodland Pond under the quarantine or the isolation or the COVID. since we did restart, we started reopening activities in June, an additional 44 of those total contacts occurred, and they would not otherwise have. Of the 44 that were attributable to reopening, 16 were basically in passing risk. 10 were because of resident-to-resident visits, again, which wouldn't have happened if we weren't in reopening. And 18 of the 44 were due to alfresco dining. So certainly the biggest risk related to reopening activities was attributable to alfresco dining. The other thing that we learned was that residents found the tracing process to be a challenge, and I can completely understand this. The tracing process requires us to collect from all exposed individuals a list of those individuals that they have been in contact with in person in the last 14 days. So speaking for myself, I would have a very hard time telling a trace professional or an individual who I had had in-person contact with in the last 14 days. This means anybody that I was in the proximity to, not touching, but in the proximity of in 14 days. So that's the requirement. And this was hard for folks. And like I said, this is understandable, but we will be providing some tips about how to make this easier going forward. We were able to confirm the alfresco dining contacts and trace those contacts through our reservation system. And that's very important because a lot of the activities that we're resuming, you will find, are all going to be reservation-based. And the primary reason for that, well, there's two reasons. One is because space is going to be limited and participation will be limited. That's one of the basic tenets of reopening. But the other primary reason, and the more important reason, is so that we can do contact tracing if and when we do have another positive case. So a lot of you have asked, why do we need so many reservations? And this is the exact reason. And that sentence finishes by saying tracing is crucial to reopening. So how will what we learned affect our approach to the reopening? I'll take you through some of the specific areas. So with alfresco dining, based on the tracing data, alfresco dining has been determined to be the riskiest avoidable reopening activity we have attempted to date. And we will not be resuming this activity when we initially reopen, which will happen Monday. There's very high risk of exposure exists anytime we eat or drink in the close proximity of another that does not live in our household. I must emphasize this, as this is going to be a common theme with all reopening messages for a while to come. I'm going to stop there for a second and just reiterate what this means. Every time we are with someone within 6 feet distance, 10 feet distance, and we have our masks off, that is too close for comfort for this virus. You cannot eat and you cannot drink with a mask off, with a mask on. So we inherently can't both wear our masks properly over our nose and mouth and also eat or drink. So as we reopen all of these activities at Woodland Pond, the message of no eating and drinking is going to be reiterated continuously. And that is why. It's because the mask is crucial and you can't both eat and drink and wear your mask at the same time. So alfresco dining is tabled for now. In terms of the other reopening activities, though, we're basically going to be going back to, reopening phase starting on Monday. There will be some changes. And I'm going to start first with the pool and then also the fitness center. So one of the things that we have identified as an opportunity for us to reduce the contact tracing numbers is to ensure that it is Woodland Pond that is providing the sanitation of the spaces wherever we possibly can. So we have identified that we have a great opportunity to provide additional disinfecting services in the fitness center by combining the fitness center schedule with the pool schedule and assigning a staff member full-time in those spaces Monday through Friday to do all of the screening of the residents that are participating in those activities, and as well provide disinfecting between each of the activities. So although we will not have the fitness center open on Saturdays and Sundays at this point, the reason behind that is because we are going to be applying our healthcare grade disinfecting services to that space in between each user, and that will be our staff doing that. It's crucial at this point for us to be able to say and sign off on the fact that we were trained, we used the healthcare grade products, we did a comprehensive job, and we can, be assured that that cleaning happened. So in order to accomplish that, both in the fitness center and in the pool, both spaces will be open from early in the morning on Mondays till late in the afternoon on Fridays, with time slots all the way in between to be able to allow you to utilize the pool and also the fitness center. There are safety tip sheets for each of those activities, which are more comprehensive than the memo that I put out today. And they really outline for the user what the safety tips are. We've done the same process with the activities that we were planning to open in July, but tabled because of the COVID case, and the bank and the hair salon. So if you are a utilizer of those spaces, you will have gotten a separate email from me today with those safety tip sheets, and they're also available at the concierge. But really the biggest difference that you're going to see is everything is reservation based. There is a time now for a staff member that will be assigned to both spaces throughout the duration of each day to check you in, to screen you, take your temperature, and then also to disinfect those spaces in between each use. So certainly once you read those safety tip sheets, if you have questions, please do come see me. And I'm thrilled that we're able to open the pool back up. The bank is going to reopen. We had been open for one day and then we had to close because of the positive case. On my memo, I was reporting that we were going to open Tuesdays and Thursdays, but just before I came in, the bank branch said that they're having trouble staffing the Thursday. So stay tuned on that. We might do longer hours on Tuesday to make up for that, but the bank will reopen on Tuesday. Resident-to-resident visits may resume on Tuesday as well, with the same safety tips as prior to the pause. And basically what that means is you may visit up to 2 households at a time is technically our recommendation. We don't want to see lots of people congregating, although technically the county rule is 10 people or less, but you've got to be outside, you've got to have your masks on, and you've got to be 6 feet apart and no eating or drinking. But those will be able to resume on Monday. One of the things that I didn't have on here because there are no changes, but it will resume also on Monday, is the salon. So the salon will come back the same way it had come back on June 16th. So, you'll sign in at the concierge for your appointment, you'll be screened, and then proceed to your appointment. So I think the most exciting thing about the memo, though, and because of what we've accomplished with the contact tracing, with what we've learned, with the fact that we're going to be testing all of our staff, including independent living residents, and the fact that we have tabled alfresco dining, we are now feeling comfortable to allow your loved ones to come visit on campus. So starting on Monday, you will be able to sign up for a visit, and we call the loved ones visit. It can be anyone. It can be a family member, it can be a friend, it can be whomever you want, but it means they can come in from outside Woodland Pond and they can come visit you at your home. So a few things. This is a high-level summary. There is a safety tip sheet at concierge, which is more comprehensive, but I'll talk about the process in a second. A few of you have reached out and asked me some questions, so I'll address those as well. But the most important thing is that the visit will be allowed at your home or elsewhere on campus, wherever you choose. The visit does have to happen outdoors. Obviously, you're going to have to walk through your apartment or through your cottage in most cases to get to the outdoors, and that's completely fine. You just can't be inside having the visit because the 15-minute exposure is the ticket to the tracing. So it's not going to take you 15 minutes to walk from inside your apartment to your patio or your balcony. That's enough time for you to traverse with your guest. You still have to keep the 6 feet. You still have to keep your mask on. But because it will be less than 15 minutes for you to get from your door to your patio or to your balcony, that's perfectly fine. So you're going to sit on your patio or sit on your balcony 6 feet apart with your masks on, or you're going to find someplace else on campus to sit. We've got the nice shaded areas in the front and in the back. We've got benches all over the place. You can go where you want. You can, go through your balcony, go outside. You can, as long as you're outside, you've got your mask and you're social distanced, you're good to go. All visits will be scheduled through the concierge, and the visits will be limited to 15 per day across independent living. Again, making sure that we're reducing the overall volume is one of the critical tenets of reopening. You're seeing it everywhere. Churches are at 25% capacity. Restaurants are at 50% capacity, you name it. So the number that we feel comfortable with for the first couple of weeks, so we can see how this goes, is 15 total visits per day. So you will be able to call concierge and sign up for a visit. And the visitor will be able to stay for up to 3 hours. So when you sign up for your visit, we are going to start taking visits at 10 a.m. each day. And the last visit will be able to start, I think it's at 3 o'clock. So all throughout that period of time, and they're booked in every 15 minutes. So you can start an appointment at 10 or 10:15 or whatever, and then the person can stay for the full 3 hours or any part thereof. The reason for the staggered signups is because each guest is going to have to be screened at concierge and as well complete a tracing questionnaire. We got new guidance from the State Department of Health for independent living communities that are retirement communities on the 9th of July. And one of the things that was made very clear is that we do need to collect a COVID exposure questionnaire for everyone that is visiting on campus. So there is going to be a little time involved there, although that form will be available on our website, and I'll get some more information out about that. So we need to allow time for that questionnaire to be filled out and for the screening process to happen at concierge along with the temperatures being taken. No food or drink on these visits because you can't possibly wear your mask and eat and drink. And, there's, like I said, there's a more lengthy, detailed tip sheet at concierge, and I did email those out. So a couple of the questions that I've gotten so far are, related to, please clarify what you mean by outside. How can we be outside if we can't get outside? So I've just clarified that. Your guests will check in at concierge. They'll be screened. Concierge will make a determination based on the questionnaire about whether or not the visit can happen. And the questionnaire covers really basically the following topics. Are you or anyone else in your household sick now, or have you been symptomatic of anything in the last 14 days? Have you traveled outside of New York to any of the states in the New York State Travel Advisory or internationally within the last 14 days? It asks if the person has ridden on mass transit or in a taxi or rideshare in the last 14 days. And I think those are the questions. I may be missing one or two, but it also, most critically, and this is what the U.S. government, the New York State government is asking of us to collect for tracing purposes, is their name, their address, their contact information. Because if we do ultimately have a case of COVID on campus, we need to do that same tracing activity that we did in-house here with all of those people. So, we talked about the one contact turned into 85 people being affected here at Woodland Pond. We would have to take that same process. So we absolutely have to collect that information, and we have to collect it every time the person visits. Because we are able to allow 15 a day, it is going to take time to kind of get through all of you if you wish to have someone come visit. So for the first few weeks, you're just going to be able to book one appointment per week, or your family or whatever. So I think we'll be able to ramp the 15 up, but we need to just kind of go slow with this. So we will create a waiting list if we get more than the 15 each day, and we'll contact you if time slots open up. So that is extremely exciting. I honestly didn't think that we were going to get to loved one visits until September, to be completely honest with you. But because we were able to so successfully trace the case that came through a couple weeks ago, and because we've come through that, knock on wood, with so far no issues. We still have a few days to go, but that plus now us being in charge of the disinfecting for the fitness center and the pool, as well as stopping the alfresco dining, and now testing all independent living residents, we feel a greater level of confidence of being able to let you have those loved one visits. We're really excited about that. We are looking at the activities calendar for October. The rules that, again, came out on July 9th for independent living communities really make it very clear that the risk areas are any type of dining. So we're going to continue on track with dining the way we've been doing it. You know, that is why Ronnie and her team are going to sit down. That is why we really need your feedback about what can make the program better for you. So if you can please get that feedback into us. It's going to be a while before we can get back to in-person dining. It's just too risky with the masks off and the proximity. So that's one thing that we have to be very conscientious of. The next is the strong recommendation is no more than 10 in any group activity. So that's going to help dictate what we do in August. And then the last is the ability to trace. And, you know, I've sort of covered that here ad nauseum. Quickly before I go, I'm just sensitive to the fact that it's going on, and I'm sure you're kind of getting bored of this topic. I will be issuing a health center reopening or a memo related sort of to visiting. We were able today to be comfortable enough to allow window visits for the first time for our independent living significant others that have a significant other in skilled nursing. We're doing this on a unit by unit basis right now for those that have expressed an interest. So we were able to allow that for the first time in months. And so that's great. And we'll look for more opportunities to do that as we go forward. But in the meantime, the governor did make a provision to allow skilled nursing facilities and assisted living facilities open back up for visitors under very specific circumstances. So there is a time frame involved because we have to submit a safety plan to the state, which we already have ours in process, but they provided some more very specific things that we have to include, which our plans weren't as prescriptive. So we're working on all that right now. We've got to submit that to the state and they've got to approve that. We also have to have had 28 days of no COVID on campus. So our last day of a positive test, as you know, was July 4th. So that, you know, that kicks off the 28 days. So we're excited about this, very excited. There will be rules. The visits will definitely be outside. That is one of the requirements of the state. You know, things will be tented. It'll be okay with the weather. And as long as the weather stays as it is, we'll be able to continue this. And we've started to already think about what happens when it starts to get a little bit colder. But we need to take this one step at a time. You know, those visits will, of course, be scheduled and there will be screening and those kinds of things. But again, I definitely did not think that the governor was going to be permitting health center visits really until September. So I'm quite excited about this. I think you've all been doing a fantastic job. I just want to close this by saying that the best thing that you can do right now is to let me, let Mary Jo, or let a friend or family member know that you need something from us. I had a conversation today with, an email conversation today with a daughter of one of our residents that basically said that her family has been struggling with, feeling like they need more. They need more emotional support. They need more stimulation, et cetera, and that this has been going on for months. And I'm just hearing it today. There's so many things that we could have done in the meantime. Not everyone is experiencing this in the same way. Some of you are feeling much more isolated or, sort of not uncertain, fearful, et cetera, than others. So we aren't painting this with a broad brush. You may be feeling quite down and like you need something from us, and you may think that everyone else is faring the same way, but that just isn't the case. Lots of people are finding ways to cope. So I have to ask that if you are one of the people that we can do something for, whether it be, getting you in contact with your loved ones, helping you find companionship, making some concessions related to, being able to see a loved one through our approved companion program. We need to know what you need so that we can help you, because everyone is experiencing this differently. So please reach out. My job over the last several months has just become helping individuals get through this COVID. I'm doing a little bit of my regular work, but most of the time, you know, Sarah and I and Mary Jo and my entire team, all of the health center staff, we're basically case managing. And we're hearing what you're saying, we're hearing what you're asking of us or what your family is asking of us, and we're looking at our whole toolkit and trying to use creative solutions to get you what you need, knowing that there are some limits to this. But the most important thing is to reach out. Reach out to me, reach out to a friend, reach out to your family, tell them to call me, whatever. But in order to help you, which is our main goal, we need to know what you need. I am around if you guys have questions. You know how to get in touch with me on my phone, on my email, and you can stop by concierge. I can come out and help you with a question. I thank you for your continued patience and support, and I'm extremely excited that we're going forward into this next step. Talk to you soon.